Chairman Schweikert, Ranking Member Sewell, and members of the committee. Thank you for the opportunity to testify today. My name is Dr. Stanley Goldfarb, and I serve as the chairman of Do No Harm, an organization of over 35,000 medical professionals and concerned citizens devoted to defending the timeless standards of medical excellence and keeping divisive identity politics out of the practice of medicine. Nonprofit hospitals enjoy extraordinary privileges under federal law, most notably their tax-exempt status. This taxpayer subsidy, worth billions of dollars each year, is designed to enable hospitals to provide care to the underserved in their communities. But instead of focusing only on curing disease, expanding access to care, and saving lives, too many are also focused on controversial and counterproductive political causes, such as diversity, equity, and inclusion, or DEI, and radical gender ideology that includes dangerous interventions on children. These practices are misguided. The problem is clear. We are witnessing hospitals that should be committed only to serving the sick, diverting their attention to political activism. They are spending millions on DEI bureaucracies and radical ideology interventions when these resources could be put to far better use. They are spending valuable time and organizational resources on these issues. This is a profound betrayal of the public mission. It is also at odds with the national priorities recently established through a series of executive orders issued earlier this year. Yet many nonprofit hospitals have been and continue to act in direct opposition to those priorities. The evidence is clear. At Massachusetts General Hospital, administrators announced in April 2024 that they would scale back child neglect and abuse reports from mothers who test positive for drugs because they feared that mandatory reporting was perpetuating what they called, quote, structural racism, end quotes. Duke University Health System, which received over $1 billion in federal funding in fiscal year 2023 alone, was the subject of federal rights complaint in March of this year for implementing race-based preferences in hiring and medical school admissions, while promoting the notion that white males are, quote, agents of oppression. Corewell Health in Michigan required every employee to sign a pledge in support of DEI or risk termination. Just 2 years ago, the Mayo Clinic pledged $100 million for indoctrination sessions about microaggressions and eliminating systemic biases and the supposed dangers of colorblindness and meritocracy. Similar DEI pledges, training mandates, and equity bureaucracies exist at Memorial Health in Illinois, Baton Rouge General Hospital, Maine Health, Kaiser Permanente, and Providence Health System, just to name a few. This politically charged approach to healthcare management is built on the false premise that our medical institutions are mired in bigotry. America's doctors, nurses, and other healthcare professionals are not racist, sexist, or homophobic. Rather, they work tirelessly every day out of love for the common humanity they see in all their patients. Radical ideology in our healthcare system is also seriously affecting our most precious patients, America's children. Between 2019 and 2023, nearly 14,000 minors underwent some form of medical intervention marketed as so-called gender-affirming care, including puberty blockers, cross-sex hormones, and more than 5,700 irreversible sex change surgeries. Many of the hospitals most deeply involved are nonprofits, including Boston Children's Hospital, the Children's Hospital of Philadelphia, Seattle Children's, Children's Minnesota, and Children's Hospital in Los Angeles. While all of this has been happening in our country, other nations have been rapidly rolling back those policies. The United Kingdom, Sweden, Finland, and others have taken significant steps to protect children and close this dark chapter of medical history. Chairman Schweikert, Ranking Member Sewell, and members of the committee, your leadership on this issue is vital. By exposing these abuses and demanding change, you are defending both taxpayers and patients. The American people should not be compelled to subsidize ideological agendas in the name of health care. It is time to restore tax-exempt hospitals to their proper mission, serving the sick, healing the injured, and advancing medicine free from politics. Thank you very much.